Bună ziua și bine ați venit la o nouă ediție a emisiunii Academia de Sanatate. Astăzi vom discuta despre asigurările private de sănătate. Avem ca invitați pe domnul Țal Levi, președintele grupului MediHelp, cu reprezentanți în România, Bulgaria, Polonia, Ungaria, și pe directorul executiv pentru România, doamna Laura Frăsinei. Discuția va fi purtată în limba engleză pentru că domnul Țal Levi înțelege românește, dar nu suficient, și din motive de claritate a ideilor vom purta această discuție în întregime în limba engleză. So, first of all, welcome and thank you for accepting the invitation. Initially, I would like to say a few words about the importance of the health insurance in general, of the private health insurance in particular. Why would a Romanian need such an insurance?
I don't think it's about the need of a Romanian. I think that if we look at the European level of need, today the situation is that most of the citizens of Central and Western Europe are in a way complementing their medical needs with some kind of an insurance policy. It started with simple products like travel policy, when people knew that when they are on some kind of a move, they would need to cover their potential medical risk with an insurance plan. But then they started to find out that in the countries where they live, there might be a shortcoming in the medical services. So when you go to the state hospital, you might not get the right service because they're very crowded, very loaded. You might need to wait to have delayed the treatment. So then you turn to the private care. If you turn to the private care, you might not find it in your country, or you find it in your country or elsewhere for a very high price. The affordability of such service might create a financial burden on some people, and therefore insurance is always the solution where there might be a very big expense where the private household cannot cope with it.
Okay, so I would like to ask you what is the current situation with the Romanian citizen? How many of them are insured? They have a MediHelp insurance. How do you assess the market of the private insurance in Romania for the time being?
We don't have as many customers as we would like to have. Let's say the customers started to be more educated than it used to be in the beginning. Now we have a portfolio of a few thousand customers, and they started also the locals. We started in the beginning to have just it for the expatriates. And a few years ago, also the locals started to be more and more knowledgeable about the need of health insurance, because the public system in Romania, in theory, is covering everything, but the fact is that it's not, the case is not like this. So.
Yeah, okay, so actually insurance, either public or private, is supposed to cover mainly the so-called catastrophic costs, because, well, for a patient, when a severe diagnosis comes, and unfortunately this happens, then there is of course a physical impact, the psychological impact, but also financial impact, which can be sometimes very, very big and very serious. Yeah. So therefore, can you give us some examples of such situation in which your insurance can give a sort of relief to the patient, at least from the financial point of view? How can you help, and maybe with some examples, such catastrophic costs, and which would be the most common situation that you encountered so far?
So I don't necessarily know that we just need to talk about the catastrophic case. It's important to know that our plans covers both catastrophic and also the usual and the prevention. And in terms of catastrophic, as we call it, cancer treatment and transplant are the ones that are the most expensive, let's say, and that can be devastating for a person. And our plans, all of the 5 plans that we are offering, are covering these catastrophic cases. We had, unfortunately, among our customers, we have people diagnosed with cancer that needed to have the cover for thousands of euros, hundreds of thousands of euros.
I would say that if it can help, I would make a quick distinction about the main subjects of health insurance, which usually covers three things. The private insurance policy will cover emergency cases, usually all over the world. And I think everybody knows what is emergency case. Emergency case can be out of an accident or an emergency that can result from an illness, such as a cardiac event or stroke or something like this. The second part is inpatient care. Inpatient, in our language, means everything that is inside the institution which is called hospital. So this is the hospitalization, the care, operations, the investigations, and everything that goes into taking care of a patient when he is hospitalized, when he is taking a bed. And outpatient care is everything outside of the hospital. That's all the consultations that we as normal people are used to go to your cardiologist for a checkup or for a medical care, need, investigation when something goes wrong. And those three things, just to summarize, emergency, inpatient, and outpatient needs are covered by the insurance policy. Now, on this, there might be some variations. There must be emphasis, for example, to lower the cover of the outpatient and to increase and to remain only with the catastrophic, like you said, that's the inpatient and emergency, or have everything. And also depends where. Do you want the cover only on European level or worldwide level? So there are some, let's say, variables to play with in order to finalize the right price and the right amount of risk you want to take. After all, each one of us is an insurance company. We all have risks in our lives, but we don't like risks. We like the risk as long as we don't have to pay for it. So the best way to do, like you do with your property or like you do with other things in life, you insure the risk because you don't want to be able to be in a situation that you will have to give away life savings and a lot of money, and sometimes people sell their house in order to save the life of a relative. And we need to understand that the catastrophic issues are catastrophic issues. There is catastrophe in medicine. It's a catastrophe for the patient, usually for the physician or for the medical team. It's a medical challenge. But when you come to pay for it, it can be a very, very expensive exercise. And some things are not cancer or bone marrow transplant or any other type of transplantations that are covered by the policy. It can be, let's say, a cardiac surgery. Is it catastrophic? Probably. Many are not, but can be very expensive.
Sorry for interrupting. During the period I spent in the United States, I clearly remember that my insurance policy was completely covering, let's say, liver transplantation, which was $300,000, but didn't cover completely the dental work that I underwent. So I had to pay partially, and for me it was quite clear which is the philosophy. For small procedures and affordable cost, the policy didn't cover completely, but for catastrophic cost, it did. So that's why I discuss this way the issue. But in Romania, your company, and in general, your company is covering such costs either here in private facilities, hospitals, or medical facilities, or abroad. From the experience that you have, what are the Romanians choosing? What do they prefer to get treatment here in private facilities that you cover for, or in European hospitals and abroad?
When the Romanians choose to have such an international policy, they prefer to go abroad. They will go in Romania just for consultation, investigation, simple things. So they will never travel just for a consultation unless there is a diagnosis that is not clear, that is not sure, that it's a catastrophic, let's say, diagnosis, and they want to have a second medical opinion. So for operations, they would go outside. also for deliveries, because our plans also cover this, so they would go outside, but for simple things here in Romania.
And outside where?
Outside, the majority are going to Europe. Yeah? Because we have the option to have European cover or worldwide cover. So the Romanians usually goes to Europe. Austria, Germany, France.
But also Turkey. Many
Also Turkey, yeah. We
Do you cover?
Yes, we consider Turkey as being part of Europe.
I see. Okay, which is normal, more or less. And also Israel, do you cover expenses in hospital?
Depending on the plan that it's chosen, yes, Israel is also covered.
Again, coming back to the basic philosophy, probably more and more, on the one hand, the patient will be aware, or the citizen will be aware that in order to at least have some comfort from the financial point of view, if a disease appears, they will be more and more inclined to have such policies. How do you see the development for the future of the system? You expect that more and more citizens will get a private health insurance?
First of all, they should be inclined to get their insurance before they're ill, not after. Because
that's what I'm saying.
Yes, they have. You must be healthy when you enroll into the program. You cannot look. If you have a minor medical condition, then we will probably take you with it. But basically, insurance is usually made when the person is fit. Look, we are market leaders in health insurance in Central Eastern Europe. In the tens of thousands of customers that we have across the region, we see rapid growth as customers, locals, more and more understand that they have to depart from the total dependency on the health system, which we know is suffering from lack of funds and a lot of problems. I always say that I feel my heart goes out to all these medical physicians and personnel that are working around the clock, usually for modest salaries and for very little pay, almost volunteering in order to give proper service. And then we come there, all we do is complain because they cannot cope with the load. This is the reality. It's unpleasant for everybody and for all the sides involved. The private insurance policy can help the customer choose his own medical direction. And then he can buy private medical care, which will help the private medical sector grow. This is good for the country, this is good for the standards of the medical care in the country, and good for the patient, the option to be able to choose. Unfortunately, not always that choice exists, and this is why a lot of them are going abroad. But for a Romanian customer, if he would like to go on a private medical care in Romania, he will get the full support from us and the full medical cover. So he does not have to go to Austria if he can find adequate solutions here. If he cannot, then he can go anywhere in Europe, like Laura said rightfully just a minute ago. So this is how it works. And we have more and more customers in all the countries where we are.
Can you compare Romania with the other?
I can. I can tell you that we have the biggest operation in Romania out of our all 4 countries where we are, but we have we are very, very happy with the Romanian portfolio. First of all, the integrity. The average Romanian customer knows how to play honest with us. We never get fake claims. We never see any bad behavior. And the retention in our language means the amount of time that the policy is on the books is very high, maybe the highest in the industry of insurance in Europe. We have more than 85% retention. That means that most of the customers would buy the policy and keep, even if they don't have claims. So there is a high amount of discipline and trust relationship, which is building up between us and the customers. And Romania is a good example of it. So in the beginning, when we thought to have private health insurance in Eastern Europe, our partners, our insuring partners in Western Europe, mainly in England, were suspicious about the level of integrity, which is proven to be total nonsense. The level of integrity and the relationship and the honesty of how it works in Eastern Europe is great, and we are very happy with this.
Oh, this is good for your business, for sure. Coming back to the type of diseases you cover and the type and the extent of the coverage, as far as I know, do you cover also second opinion? If a patient wants to have a second opinion, is this covered by?
Yes, it's covered by our plans. So if he gets a diagnosis here, for example, in Romania, and he wants to have it like confirmed or not, we can help sending the documents to the insurer, and we will have the second medical opinion and also the plan of the treatment for that specific condition. So we can also help with this.
Yeah, and this is important because sometimes it's very recommended to have at least two opinions before making a decision. And regarding the medical facility where the patient goes, my understanding is that you cover practically all the list that you offer to the patients, but sometimes if the patient is asking for a certain recommendation,
we can give some recommendations. We will never say that is the best medical facility because we can't take this responsibility. We give 2-3 options and the customers choose. Usually the customers say, I want to go to Germany. So we are giving few options in Germany. And then the customer chooses and we arrange, or in Romania. I gave just the Germany as an example. And then we arrange to have it to have direct billing, and the customer does not need to pay for a big amount of money. As long as we know in advance, we can arrange.
Maybe this is a good opportunity to show and emphasize the difference between an insurance plan and abonnement, which is very popular in this country. If you bought an abonnement from a chain of clinics, you are subjected only to this clinic. You cannot go out of their service range. So if you're a customer of chain of clinic X, then you will be able to get your treatment only in this clinic and only in Romania. And whatever they have, you can get. Whatever they don't have, you cannot get. Many problems with this, because if, for example, a lady has a doctor for her child and she trusts and for many years she's a customer, and then that doctor moves from clinic X to clinic Y, then you have a problem. If you go to another clinic, your abonnement will not cover it. If you want to continue with that clinic, you have to accommodate to a new doctor. And this is a good example and a good opportunity that you gave me to explain what is the free choice idea. We do not want to make the medical choice for the customer. We want to give him the option and the financial ability to pave his way to the medical care by his own understanding. So the free choice idea is that you can go anywhere within your country or abroad. So if you don't know where to go, we might tap you to a direction, but we will not tell you you are not allowed to go left or you should go right. So it's a let's say, show a direction would be the right answer here.
Yeah, I understand. Actually, what you say is that your coverage is complete, and therefore you allow the patient to choose. But on the other hand, sometimes the patient doesn't know what to choose and how to choose, does not have the criteria, and he or she might need some help.
We are aware of this, and this happens. And in situations like this, we are trying to give the customer the 3 or 4 most popular names in this country or abroad, so he can choose out of a small range. And we are narrowing the search, if to take the idea from the world of Google.
No, I think in the future medicine will become more and more specialized. So therefore, for the patient's benefit, it's good to know where is the highest volume load for a certain procedure or for a certain disease, for a certain treatment, and oriented the patient there. Actually, it's offering him the best chance.
With one reservation, Professor Popescu, because if you are telling the customer to go to a certain place and something goes wrong, you are responsible.
Yeah.
So we would not like to assume responsibility on the care of a specific clinic We would like to tell him like this: you can go to a list of options that we are giving you, and out of those options, whatever you will choose is your responsibility. We shall make all the payments. We shall create for you the opportunity to choose and to get the most expensive, if needed, medical care. And we shall pay for you, sometimes in advance, if the customer has a planned appointment for an operation a month before. We shall go to this clinic before, we shall make the payment before, and when he reaches the day of the operation and the time to be hospitalized, everything will be already done for him. He will not have to stand in line and worry about any financial needs. We shall pave the way for him and make it possible for him to worry about only the actual medical challenges that he will have. And as we know, sometimes this is very hard.
Yeah, I think one of the biggest problems for you is to keep being cost efficient, let's say, to offer most comprehensive coverage to your insured people. But to also to have affordable prices for the insurance policy.
Very, very important point. Our average policy, just that you know, if you are around 40 or under, you might reach 1,300 or 400 euros per year. And that is for a household, for a couple, for a young couple who are working and having a normal income, it should be affordable. And so it is not a mass production for low-earning people, unfortunately. I hope that as our industry grows, we have more and more customers, our ability to build affordable plans on a lower prices will go bigger. On that discussion, I had discussions with the Ministry of Health and Ministry of Finances in this country and in other countries. It is very important for the state to recognize the importance of private health insurance as it releases the burden of the taxpayers for medical care, transfers the responsibility for the medical care to the person himself, and allows the private sector to grow. This is a win-win situation for everybody. So health insurance, like in the Western countries and in many others, I can give many examples, has become a leverage for medical development and for better care for the people. So the Romanian government will do best if they would encourage this industry to grow, not only on us and anybody else who wants to come on board. And right now we are almost alone in this industry, unfortunately. I would be very happy to see some competition coming up. And then,
competition is good, eh?
Yeah.
Absolutely. I'm not. If I hear that there are some other insurance companies who are selling already. They began to sell some lower standard than us medical insurance plans for groups, and they are almost like abonnement. I like to see this. We are not in this level, but we like to see this, and we hope that they will grow together with us into a massive industry of health insurance, like you can see in Germany, in France, in Holland, in Belgium, in UK, just to name a few around us, but of course there are many more examples to show this. This is the right and healthy way to have the state medical care narrow its responsibility and shift as much as possible to the private care. This is the way that it's done all over the world.
Well, but in this regard, if something, let's say, it's covered by the state insurance, a normal insurance, you don't need to cover, so you just cover the extras, and I think it could be a...
Very good. So if, for example, you went to medical care in Funden Hospital or in any other, and you had your operation there, you did not pay anything, obviously we shall not make the payment for what you did not pay.
Right, no, but sorry to interrupt. Talking about new drugs in cancer especially, which are very expensive, if they are covered by the state, so then I think you don't need to cover them.
We will not do any double coverage, but you have the choice to decide which direction to go. So if you went to private medical care and it necessitated some medication that you took on a private basis, we should cover for you. But you have to know that basically there is no competition between us and the state, and we are not pushing the customer to go to the state where it's his choice. It's a free choice. Back to the free choice idea.
This cooperation should be, because again, the budget of the state is limited, but within those limits could be some very important coverage also that helps also.
One of the things that I up to now was not very successful in doing, and maybe this program of yours will create a change from negative to positive. I could not make the government sit around one table with us and discuss about the ways to develop the symbiosis between the two worlds. And there is a symbiosis, which usually works everywhere else in the countries I've mentioned before. There should be, first of all, a tax relief, much higher than there is now. So the state has to encourage employees, companies, to buy for them, for their employees. Employees, or I said employees. Yes, I was wrong. Employers to buy for their employees medical care, so they can first of all be healthy if they are sick and get proper medical care on a private basis as soon as possible, as a benefit for good employment. And in the end, usually when a customer is using his medical care, medical insurance policy, he does not tend to use the state services. He will always prefer better care in a higher standard in a private place, where there is. If there is no, then he goes to the state and gets medical care there. And we all know that in the state of Romania's hospitals, there are very good doctors and very good options to get excellent medical care. This is the reality. Then okay, this is very good that he goes there, and obviously he did not make any payment and we did not pay. Once I told the Minister of Health, one of the former ones, that it would be nice to have maybe an insurance that I am ready to offer for the whole citizens of Romania. So when they are, if the state of Romania will cover for it, we will compensate the state for some of the, but for this they have to pay us, yes, and this is of course not, there is no legal basis for it, but it's just to tease the intelligence exercise here. It's not really an option.
I see. So one last question. How do you think that you will deal in the future with the increasing cost of the healthcare? Because unfortunately, because of new technologies, new drugs and things like this, the costs are increasing every single day. So
yes, but the cost is increasing not only for the private medical insurance, but also for the public healthcare. Yeah. The problem of the increase of the healthcare is something that the Romanian public has to learn to live with. This is a worldwide phenomenon. It's not about Romania or about the Romanian healthcare. It's not the Romanian healthcare fault that it's like this. It's the, I think we spoke about this earlier on in one of our discussions. It's the increase of the price of the technology, and the drugs. It's the fact that there is a higher demand of healthcare, because the population is living longer, and the population is generally older. In Romania, we know very well that the population is getting older. So what is the big surprise here? There will be a bigger amount of people living longer, demanding medical care, and the state is not having a bigger chunk of tax to cover it. So we have to understand something will happen here. There is no miracle. Either we all agree to pay more taxes and inject more money to the government, which if we rule out inefficiency factor or sometimes corruption or other problems as such, can make it difficult for them to offer the care in the proper standard, or people will have to buy their own healthcare, which might be.
Yeah, but a solution to face the increasing cost would be prevention, I would say, to promote prevention more, and maybe to penalize those people that don't respect actually the...
There is a way to penalize by insurance premiums. Right now we are not doing this. We are still on the moderate side. We are promoting prevention and healthy living among our customers by collecting good articles from important professors and institutions who are good writers in the nutrition, in exercise, in riding bicycles, in how to check up yourself, what how to run your life in a way that will promote your health and not act against your health, smoking, etc. So we are doing the best we can, and this is not easy. I hope that more and more Romanian citizens will come on board and buy insurance plans for us. It will help them keep their health. It will help us make the product more popular.
Okay, I thank you very much.
Thank you very much.
Thank you very much.
It's been a pleasure to be here.